Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Everybody hold on to your hats because it's a rare thing when you can be in the same room with Dr. Nabil El Sanadi, who is now president and CEO of Broward Health. And I say that because he is very busy. Everyone's pulling at him. Everybody needs him for everything. But he decided that he would do this radio show that he could really tell people what's going on, not read it in the newspaper, that they know why Broward Health is the best health district, which I think it is anyway, and what your responsibilities are. So I'm just going to let you talk, and I guess my first question will be, why are you doing this?
I'm doing it because it's an honor, and it's a pleasure to be with you. This is, I think, my second or third time on your radio show. Thank you so much for inviting me, and I would make time to be here anytime.
Well, you're so kind. And I love what is happening here in Broward Health.
Yes.
The growth of this, I don't know how many square miles Broward County has, but I know it's a lot. It's going way west, and, of course, it's very far east. And what are your responsibilities? Let's start with that.
Very good. So, first, I want to say thank you again for having me on the show. I'm honored and delighted to be responsible for Broward Health, which is the 9th largest safety net system in the United States. The population we're responsible for is north of Griffin Road, south of Hillsborough. It's 2/3 of the Broward County population, about 1.3 million people. And I could tell you this, I managed the emergency departments for 6 or 7 years. We saw about 330,000 patients between the 4 emergency departments and the 3 urgent care centers. Standing on this side of the administrative divide, I see an unbelievably well-run, very smooth system that has 1,500 beds, 1,500 beds. Out of those, there's about 170 pediatric inpatient beds. Very few people think of the facets of how complex the system is. So we have an embedded children's hospital, not just at Broward Health Medical Center downtown, but also at Coral Springs. We provide totally vertically integrated care. Downtown Broward Health Medical Center has a level 1 pediatric trauma center, 24/7, 365 with board-certified ER docs with trauma surgeons to back them up for pediatric traumas. At Coral Springs, same thing, 24/7, 365 pediatric emergency department. Not a level 1 trauma center, but we certainly manage all pediatric emergencies 24/7, 365.
Well, let's let the population, who of course are listening to our show, maybe aren't familiar with those words. What is a pediatric trauma? What would we see?
So pediatric traumas are unfortunate children that have had bad accidents happen to them. And we know a couple of examples that have been publicized in the media. There's a young lady by the name of Stephanie. She was 13 years old at the time. That was the girl that was driving with her mom in a minivan, and then a beam came through the window, impaled her to the seat of the car. And then the mom had the presence of mind to drive the car over to the emergency department, of course, with an EMS and a police escort. 13 years old, beam through the chest, comes to pediatric trauma center. Not only was her life saved, she was a very fortunate young lady. She left the hospital 5 or 6 days later with no damage to her heart, no broken bones, and just a puncture of the skin and the lung. An amazing thing. A pediatric trauma. Another couple of examples that we remember are the 2 girls that were parasailing, where the tether from the parasail boat broke, and the 2 girls hit the side of a building with the parasail parachute. Both of those children came to our trauma center. So this is examples of pediatric trauma. Of course, 2-year-old that fell out the second-story window, those kinds of things. That is what pediatric trauma is.
Wow. So we're now saying that we are specializing in this, it sounds like to me.
We've had that specialty, and the service has been provided for years. And my job as a doctor CEO is to showcase the doctor part or the clinical part of all of what we do. As I crossed the bridge from being mostly clinician, partly administrator, to mostly administrator, partly clinician, my job is to actually be the spokesperson for over 9,000 employees, for over 1,800 doctors, for over 900,000 outpatient visits that we've had. These are touches, patients that come through the system. And again, we're responsible for 1.3 million people. It's our taxing district. So it's a huge, huge responsibility, but it's an unbelievable privilege and a great opportunity to showcase all the unbelievable life-saving work that we do at Broward Health.
Yes, and I know all the CEOs, and they are very dedicated. But I want to move way back. I jumped into this very quickly to tell people about your administration and what's happening with you, and the fact that this is a new position, but that you were a very well-respected physician in the emergency room where I first met you and where I was very privileged to go through, scared to death. I have to tell you, I had never been through an emergency room as you took me. I'll go way back because I also heard a story I didn't know about you in the early years, that you're really kind of a Renaissance man. You started out not knowing what you were going to do.
Yes. So this is the Renaissance man. I don't know, but I can tell you this. I started out as a chemical engineer on that track at Case Western Reserve University in Cleveland, Ohio. And then on a dare, I was asked by a couple of other co-commuters, people that used to travel back and forth between home and the university, in the Commuters Club, on a dare. You're a foreign-born, your name is strange, Nabil El Sanadi, and we bet you can't get into medical school. That's one of the hardest schools to get into. So on a dare, I submitted my application and got accepted.
And when was that?
That was in the late 70s. And went to Ohio State, which was a state school, and I learned a lot of good medicine then. Of course, I couldn't go back and tell my mom, on a dare, I got accepted to medical school, but I'm going to stay as a chemical engineer. I had to tell her, I got accepted to medical school, and your son will be a doctor. So, and the rest is history. So,
and so your parents were very influential in your life, it sounds like.
Absolutely. So of course, they're my heroes. They both passed away, but I grew up in Egypt, and one of the things that they instilled in me that was very, very, very important is how precious knowledge is. The more you know, the better off you are. No one they can take away your watch, they can take away your car, but nobody can take what's in your mind, your knowledge. So they emphasized that, and as I grew up, I appreciated that as a fact. And then basically, that if you think of what I've done, I'm a lifelong learner. I went and got an MBA, went and became a Six Sigma Black Belt, which is statistical process control and management. I went and became board certified as a healthcare executive. So learning is part of my life.
But you're a big time management person. You have to be in order to have accomplished all that.
Well, you know what? Of course, I manage my time, but I also love managing other people. And I just enjoy the dynamic of being able to lead a team that is very, very well organized and orchestrated to achieve something good, whether it's in the emergency department to try to save somebody's life, emergency medicine and trauma surgery at the bedside, or a large healthcare system where you have inpatient, outpatient, surgeons, all 27 flavors of surgical and medical specialties synchronized and focused on the welfare of patients. That's what my privilege is, to be able to try to do that and to do it well, manage the team.
Right, and of course, I always say that the leadership starts at the top. So what you're feeling and what you're organizing is going to then stream down to everyone else, and hopefully we're going to have a lot of little El Sanadis running around.
There's 4 little El Sanadis running around, but I hear you. But big picture-wise, you're absolutely right. It's re-engineering the culture, making sure that everybody thinks that the patient is always at the center. The patient is always the most precious part of the equation, that we need to not just take care of them physically, but we need to take care of the patients emotionally. We need to take care of intellectually, and also, so we need to explain things to the patients. We need to be able to hold their hand and to comfort them. Plus, take care of their physical ailment, whatever it is, a broken arm, a heart attack, a stroke. There's also a dimension, the spiritual dimension. So there's 4 dimensions, and we already have an outreach in the clergy community, non-denominational, whether it's rabbis, ministers, priests, and so on and so forth, to be able to talk to those ministers as far as the spiritual dimension of what patients are, and then try to hook them up with us as a healthcare system. So we're looking to the total patient, and how can we do that better?
My guest is Dr. Nabil El Sanadi. He's the president and CEO of Broward Health, and he's probably only been doing this for a couple of months, if that.
December 20th, last year.
Oh, wow.
5 or 6 months, yes.
So it has really been going good. And I'm Anita Finley, and we're having quite a joyful discussion about what happens in hospitals, what happens with patients. And I was just curious as you were talking, medical schools,
yes.
are they going to get what you're hoping? Because it all has to start with the doctors from the medical schools.
Right. So we're affiliated with a couple of universities, as you know, Nova Southeastern, Florida International University, and we have their medical students coming through the system. And what I'm hoping to be able to do, as you said, is to actually have it permeate from the top down to the medical student level, where at the bedside, in that culture, they actually learn how to take care of the patient in all 4 dimensions. So it be excellent clinicians, great doctors, be able to suture and heal the wounds and take care of broken bones and so on and so forth, but also be able to sit and hold the patient's hand, comfort them and the family members, and then on top of that, explain to them what happened to them, especially in an emergency. Nobody plans to have an emergency. Things happen suddenly, somebody's life changes, and we need to be able to catch that person, help them physically, and then talk to them intellectually, explain to them, and then emotionally basically give them a hug. And then from there, make sure that whatever they need after the care, they get the right kind of home support setting, and then from there be able to follow up with our system just in case there's a follow-up need. Let's
go back to what you just said, because there is some confusion. I've heard this from people. They don't understand if a doctor is at a hospital, does the doctor work for the hospital? Is that a hospitalist, or are there outside doctors? And how does that work?
Excellent question, Anita. So there's a lot of flavors as far as how hospitals interact with doctors. There's hospitalists, and those are doctors that stay in the hospital. They usually admit patients and manage them. So the examples are internal medicine or intensive care, where there's somebody that's a doctor in the intensive care unit 24/7, 365. That's the hospitalist model. Then there's employed doctors. We have several of those that are working inpatient and outpatients. For example, orthopedic surgeons, they can see patients in their offices, they can see them in the clinics, and then they also do surgeries and take care of patients in the hospital. And then there's doctors that just have privileges at our hospital. They're part of the medical staff, and they go to several hospitals, and their patients get to choose. Do they come to Broward Health? Do they go to other systems, and so on and so forth? So there's a bell-shaped curve or a spectrum of interacting with doctors between the hospital system and the doctors.
Thank you. That's there's always confusion with people because they don't know.
It's complex.
Who's taking care of them. Well, you're so experienced in the emergency medicine because that's what you did for so long. While you were there, you did increase the size of the emergency medicine, and I guess now we have a lot of these little pickup clinics all over, and I don't know. I have a problem with them because they don't. I think they should go to an emergency center rather than that. But you have to help me with that. Tell me what I'm saying.
So there's in Broward County alone, there's 82 last count urgent care centers, and they're for profit. They're located different places. And to your point, if you come to an emergency department at Broward Health or go to an affiliated urgent care center, the anchor facility or the mothership, the way I would think of it, is the Broward Health system that has all 27 specialties of medicine represented. They have a lot of services intramurally in the hospital and also in the outpatient setting. So coming to something like that, it actually gives the patient a sense of, yes, it's safe to go to those urgent care centers. The freestanding urgent care centers that are for-profit, sometimes, I don't want to cast aspersions or anything like that, but the quality of the care and the level of expertise and experience of the providers that you may go to see may not be at the same level as providers that are anchored in a large healthcare system. So caveat emptor, meaning, buyer beware, and patients and our listeners, the citizenship of Broward County should be aware of where they go. They should try to look for a board-certified doctor. They should see what their credentials are. They should make sure that facility has some place just in case the heartburn is a heart attack. So if it's something more serious than what it is, and you end up at one of those outpatient facilities and they don't have a transfer agreement or they don't have a backup system, that could be actually compromising patient care. Now, for things like a sore throat or runny nose, if you're not able to get a hold of your primary care provider, your family practitioner, then going to one of those places, it's okay. Although I have to caution everyone that a sore throat may not just be a simple sore throat. It could be something else. So,
and when you call your doctor after hours, the first thing they say is, if this is an emergency, call 911.
Absolutely. And that's what they do. It's an issue of liability, but it's also patient-centered because patients don't know. They're not doctors. So if you think you have something that's really bad, call the paramedics, call 911.
Of course, people hesitate to do that. They're embarrassed. They're nervous.
Yep.
But the most important thing is when they get to the emergency room, the center, that they're treated well and that they're scared to begin with and that the families are there.
Yep.
And that's a very important part. I know that you really work very hard to make sure that all that worked well.
Yep. And that's, so I've done this for over 20 years as an emergency physician. And I've always been fortunate to be a manager of one kind or another. And that is exactly the point. The patient is the most important person. We have to take care of them as best as we can clinically, but then also spend time with them and their family. And one of the things that the audience, your listeners need to know is that in an emergency, sometimes we do triage. So somebody that comes in with a sprained ankle may have to wait a little bit longer than someone that comes in with a stroke or a heart attack. So that's like a point of information. Most people go, well, I'm going to go to an urgent care. It'll be fast. But, and that's okay. But if I go to an emergency department, I may have to wait. The reason sometimes people wait is because of that triage. The highest acuity, the most life-threatening condition always goes first. So somebody waiting in a waiting room with a sprained ankle may have to wait till 1 or 2 or 3 patients with a stroke and a heart attack and a broken femur or whatever go first. Then they get to be seen. But, that's not discouraging people from going to emergency departments. That's just the fact of how emergency departments work.
Well, actually, it's interesting you should mention that because I do a lot of seminars and I teach people how to be sensitive. It's called senior sensitivity training.
Right.
And that's fine as long as when the person gets there,
right,
that's explained to them that we know you're here,
yep,
but we do have somebody who has just come in with something very serious.
Right.
Then they don't mind waiting.
Right.
And so that's really very key that you're the receptionist and all the other people there who are in charge are able to do it. So as long as this is centered on the human being,
of course,
and I'm sure it is,
yes.
And I'm very proud to actually be so involved with Broward Health. And so I know all the goodies that are coming up.
You know what? We're proud and we're thankful that you're part of the Broward Health structure and framework. And to your point, as far as letting patients know, we've instilled something in the staff in the emergency department. It's rounding. People actually will round in the waiting room and talk to people to say, you're next, or, you're waiting because this is going on, that's going on. So big picture-wise, we practice what we preach.
And it's called rounding.
Rounding, yeah.
Well, our listeners now, when you get there, you say, how about rounding?
Yeah. Are you rounding on me? Where is the person that's going to round on me to tell me what's going on? Ask for that.
That's excellent. No, you have to. Yes. So, Dr. El Sanadi, so now we know that there are very big things that are happening with Broward Health. Right. This is going to be spectacular with the Children's Hospital. We're raising money for that. And then the Neuroscience Center over at Broward North. And it goes on. And then Carl Springs, it's burgeoning out there. So how do you manage to get your hands on all this?
So actually, the beauty of being where I am is I have thoroughbreds, people that are very, very good at what they do at the different centers. So let's talk about Coral Springs. Parkland is growing. More people are moving there. Coral Springs is becoming more populated with younger adults, with children, and so on and so forth. So we need to grow the practices there. I need to support Drew Grossman, who's the CEO of Coral Springs, make sure that he has all the resources that he needs, not just money, but also whatever else as far as specialties. Does he need more cardiologists? Does he need more ear, nose, and throat specialists? Does he need more pediatricians? How can we open our doors to the community that we serve and tell them, we're here, we're ready, use us? Because you pay taxes. We are a tax-assisted system. Technically, the hospitals belong to the citizens. They support us. They pay the tax money. So that's the Coral Springs initiative, growing the practices and opening the doors there. Broward Health Downtown. My job is to showcase the most unbelievable team of doctors and support staff that work there. Trauma Center, Comprehensive Stroke Center. Basically, they have people that do magical things in the heart cath lab, structural heart disease. We have specialists that take care of valve issues and heart muscle issues. So with that, also growing the teaching programs at Broward Health Medical Center. We need more doctors. part of the Broward Health mission is to teach new young doctors that will hopefully stay in the community and replenish the workforce. Of course, one other thing that I'm going to try to showcase, propel, and highlight is research. We need to not just only be at the cutting edge, we need to be creating the cutting edge by creating new knowledge. That's what research is all about, where you're able to ask a question, is this drug better for that disease state versus that drug? Or is this kind of material, ceramics versus titanium, better for hip replacement? So if those questions are being asked and we have the drug companies and equipment manufacturers supporting us and using our population, of course, with the population's consent, to say, would you like to try this or would you like to try that? That is actually research and evidence-based medicine. So that's Broward Health. North Broward, you're absolutely right, neuroscience. We're going to showcase that. And at Imperial Point, we have to basically cater to the community and the population. So we're going to focus on people that are a little bit more senior, that are aging, and we need to be able to catch that population and take care of it.
That man van is a good example. I love that man van. We always kid about it. And
yes.
What we really need, a lot of the women want men on the man van, but that's not what it's for. I'm kidding.
ANITA, we don't do that service, but
I know.
But we do have social events that we...
I know. I go to the social events there at Imperial Point, and they are amazing how many people come, sometimes 60, 70 people, and it's so important for them. They do it once a month, usually during the most of the months. And I've watched how, that's what it is. Hospitals years ago was a frightening place.
Yes.
But over the last probably 15 years, everyone has now realized that it needs to be almost like a senior center or a place where they have support groups. Right. It's been very smart marketing.
Well, I think it's not just marketing. With the concept of a hospital, just think of the word, it's hospitality. We're there to take care of patients in all four dimensions. We're taking care of them physically, taking care of them emotionally, and that's the part you're talking about. We're there to be there with open arms, to be like your family when there's something bad going on for you physically. That's what we try to do.
And you do. And for people who are listening, you're probably saying, who is this smart man on the show and what does he do? And you're hearing this. Dr. Nabil El Sanadi is president and CEO of Broward Health. Yes, it's a big job, but somebody's got to do it. And you'll be seeing lots of press. You have been getting such good PR. I don't know who's helping you, but of course you're easy to do this with because you have such a sterling reputation and you're so enthusiastic. Did your parents? Is this something that you got from them? Where do you get the enthusiasm?
Well, you know what? The way I think of it, I'm blessed to do what I'm doing. And just think of it. It's a privilege to be able to wake up every morning and to say, how can I make things better for patients, for the employees, for my fellow physicians? How can I do that? And just to be able to walk into that every day, I cannot not be enthusiastic. I mean, I love it. It's a great thing to do. And I want to continue to do it. And I'm hoping I'm making a difference.
Yes, you are, and in such a short time. I didn't realize that it's already been 6 months. But so the other aspect of Broward Health, of course, is that we are struggling for funds.
Yes,
I mean, and that's something we probably ought to talk about. And I know that you want to be an ambassador, not a politician.
Well, good, excellent point. So I'm not a politician. I think of myself as a diplomat. Politicians use convenient rhetoric at convenient times to woo the audience. For me, I try to use diplomacy, where I try to reach out and I try to tell people how important it is that we have a healthy fiscal state. The dollars are very important. We're very, very careful as far as how we spend money as a healthcare system to make sure that the money, every penny spent, is actually money that we get from, 10 to 15% of it is from the tax base. So it's your money. It's the audience's money. We have to be very, very careful with that. We use it wisely to provide good health care, to provide good management, to make sure that the employees are feeling that they're appreciated as far as the kind of care they deliver. So that's why money is important. Now, a couple of things going on in Tallahassee, and everybody has heard the debate as far as Medicaid expansion and low-income pool funding. The way I think of it, and that's been my rhetoric wherever I've gone to, I've met with the Secretary of Health, Ms. Burwell. I've also met with our governor, and I've met with the Democrats and Republicans, House and Senate in Tallahassee. Very important to know, everybody should be focusing on patients first, not politics first. Patients first. So patients, not politics, that's been the mantra, and I will repeat it. I'm a physician. by training, I take care of patients. So we need to take care of the patients. The money will work itself out. And, the rhetoric and the heated debates and so on and so forth, as far as where's the money, where's it coming from, my posture is this. The money's there. We're going to work through how it comes to the healthcare system. Let's just continue to focus on the patient being in the center.
Okay, so now let's focus in on the patient.
Yes.
So the patient has to cooperate.
Of course.
The patient has to stop smoking.
Yes.
And they have to lose weight. And
Yeah.
you do have programs. You have support groups at a lot of the
Absolutely.
At the hospitals. You have something we ought to talk about too, the spa. I mean, that is unique.
Yes. Very few hospitals can say they have a spa. And to tell you specifically as far as patients and how they come through the system, when you look at the big picture, it's very important what we do. It's not that I'm trying to drive business away, but wellness and prevention is very, very important. So for all of our listeners, smoking is bad. Being overweight is a challenge. A little factoid, Anita. 60% of school-aged children in our county and in the state of Florida are overweight. 20% of those children, over 20%, are actually obese, and that's a diagnosis. So being overweight is something that could predispose people to heart attacks, strokes, early, having to have knee replacements and hip replacements, wear and tear on the joints, and that's just a fact. So the thing to do is, if you can, and if you need support as far as stopping smoking or losing weight, we provide those services. We try to do wellness and prevention.
I just attended a meeting, I guess it was at the Broward Health Foundation meeting, and they had the whole wellness organization come in. I was so impressed. I couldn't believe what's going on.
That's a huge focus. So one of those things, as we're moving forward in time and being responsible for money, the best way to save money is not to have consumption of healthcare. So what does that mean? Losing weight, stopping smoking, not texting and driving, wearing a helmet if you're going to go skateboarding or rollerblading, and then choosing the kind of lifestyle. Certainly recreational drugs, I'm not going to even mention that. Recreational drugs should not be used at all. So wellness prevention, fewer dollars will be spent on acute health care.
We're going to have Dr. Nabil El Sanadi back another time. I just want to thank you so much. It was so much information. I know
Anita,
people
thank you so much for having me.
Panting at this because now they're going to become a lot more aware of what's going on at those big, beautiful hospitals.
Thank you, Anita. Thank you for having me.